Thank you, Mr. Speaker. On a positive note, I'd like to begin by congratulating the Minister of Health on setting a new record. The AHS first quarterly performance report, essentially a wait times report, is now 65 days late. The previous record was 63 days when another AHS wait times report was delayed until after the 2012 provincial election. To the Minister of Health, congratulations on your accomplishment. Now, could you please tell us how much longer we must wait for the wait times report?
Honourable Minister.
Well, Mr. Speaker, I think what the honourable member is referring to is the quarterly performance report that AHS provides. And as I've said in answers to previous questions, Mr. Speaker, we are in the process of reviewing the performance indicators for our healthcare system. The official administrator is working on that with senior staff now within the organization. We'll continue, as we do on a regular basis, Mr. Speaker, to make information available about the very good performance of this healthcare system to all Albertans.
Honourable member.
Mr. Speaker, the deadline for this report was September 1st.
Why are you missing it?
As I mentioned, the last time we waited this long for an AHS wait times report was before last election, and that report was pretty bad. Yeah. No wonder they didn't want voters to see it. And now, lo and behold, the Premier's leadership review is coming up, and the wait time report is nowhere to be seen. It must be pretty embarrassing. Ooh. To the Minister of Health, did the Premier ask you to delay this report until after the leadership review, or did you do it simply on your own initiative?
Well, Mr. Speaker, I suppose it's refreshing to know that the honourable member can count, and it's perhaps not surprising to note that his fascination with conspiracy theories appears to know no bounds. Mr. Speaker, we've said very clearly, and we did so again in the organization of the senior management of AHS, that we were looking very carefully at performance indicators in our system. We want to make sure that it is not late, Mr. Speaker. It is something that is provided routinely, and when the statistics are ready, they will be provided, Mr. Speaker. But I want the honourable member to know that our commitment is to reviewing the indicators to make sure that they're relevant to Albertans, to make sure that they report accurately on performance, and most importantly, to make sure that the performance of this health system cannot be distorted by the opposition.
Mr. Speaker, Dr. Eagle used to have that report within 7 to 14 days. No conspiracies here, just incompetence. Mr. Speaker, the reason we need the darn report is because we're heading into flu season here. We need to know where to make adjustments in the system. And that's why these reports are important. The managers and medical professionals need timely access to this information. You would know this, Mr. Speaker, because you got these reports out on time when you were Minister. They need to plan to get Albertans the timely access to care they desperately need. To the Minister, once again, will you please just release the quarterly reports on a quarterly basis?
On time.
On time.
Honourable Minister.
Well, thank you very much, Mr. Speaker. If the honourable member is interested in performance statistics on the healthcare system, I'd be happy to indulge him on this day or any day in this House. Mr. Speaker, the volumes for hip and knee surgeries during the past 3 years saw more than 1,800 additional surgeries performed. Hip surgery wait times, and these figures are readily available on the AHS website, went from 39 weeks to 36 weeks, a decrease of 9%. Knee surgery wait times have decreased by 15%. Mr. Speaker, we can turn...
Honourable members, and I'm going to ask the honourable ministers to start right from the beginning. The interjections are uncalled for. I've warned you about this before, and I just don't appreciate them. And I wonder what people who are in the rest of the Assembly here think about them as well. You know they don't get picked up on television, they don't get picked up on radio, but they do interrupt the ebb and flow of the House. Now, Honourable Minister, you have 10 seconds left to finish your answer.
Well, Mr. Speaker, thank you for the opportunity. What I'll say and continue to say to honourable members of this House is that our health system is working hard to improve performance. We lead in several areas in healthcare across Canada. We're also coping with the fastest growing population in the country. We'll continue to bring that good news to Albertans.